even as you're listening to this, you could probably have feelings one way or the other just listening to this. And I don't mean, oh, this is what she believes or this is what she doesn't believe. I mean yourself, where you're like, I agree with this or I don't agree with this. And why is that? You're going to have your own thoughts regarding this. You're going to have your own feelings about it. And I think it's really important as a mom that because of that, like call that intuition. There's a reason that you are feeling and thinking those things, and following those is really, really important. So getting pregnant and giving birth are two of the most exciting things you can ever hope to experience in this life. The moment you think you could be pregnant, you're frantically searching for all the best information, which is why you're here today. I'm Stephanie King, and with my many years of experience as a professional childbirth educator, doula, and lover of all things pregnancy, birth, and postpartum, I'm here to make preparing for your birth enjoyable, empowering, and totally easy. Each week, I'll cover different topics, interview professionals, and get into the nitty-gritty birth stories from mamas just like you. And when you're ready for more, you can join me in the My Essential Birth course at myessentialbirth.com, where I take you step by step through exactly how to prepare your mind, body, spirit, and partner for a birth you love. So let's get started. Our reviewer of the week is M.E. Covell123, or maybe me Covell123, either way. She says, I am a pelvic floor PT, and I first started listening to this podcast to learn more information about pregnancy and birth for my clients. I love that so much. Thank you for all of you professionals that come along for the ride. It's so cool. I continued to listen throughout my own pregnancy and was overwhelmed at the amount of helpful information that helped me prepare mentally and physically for my own delivery. I loved listening to all the positive birth stories and found the information in the class very helpful. I am now a proud mama of a 2-week-old little girl and enjoying all the information in the postpartum course. Thank you, Stephanie, for all that you do. Thank you so much for leaving an awesome review. And I'm so glad you get to use it with your clients. And I love that you were able to use it for yourself. For all of you guys that are just following along and doing all the things, it just always impresses me, especially you like early moms. I know I've said this before, but you like first time moms, I praise your names, because getting this information early makes the biggest difference. And you guys are just so ahead of the game. Like I was one of them that had a bad situation the first time, and that's why I went searching. But you guys are so smart and you just get the information early and stay strong in it. So good for you. Today, we're going to kind of take a deep dive into a topic that I've definitely covered on the podcast before, but I do think sometimes these things just necessitate a little bit deeper of a conversation. And so we understand the background or just have more information. It's always helpful for me when I make decisions for myself or for my children to get all the information that I can. And so why I can't do that with everything all the time. I did want to pinpoint this one because I don't want to say it's controversial, but it's something that women wonder, like, do I get it? Do I don't get it? Like, do I really need it? Does the baby really need it? And again, like, I'm not here to tell you one way or the other, but I do think having a good amount of information is just super helpful. So there's a couple of things that happen once your baby is born. So after cord clamping has happened and you've had your skin to skin and you've had that first breastfeeding session and your golden hour and whatever else you're deciding to do, postpartum, immediately postpartum, there's also a couple decisions that you're going to have to make. And this is where I know we've covered this before, but I want to talk specifically about vitamin K. But vitamin K is one of them, hepatitis B, and erythromycin, which is an antibiotic ointment that goes in baby's eyes. The other two are injections. And vitamin K is not a vaccine. It is an injection. And we're going to talk about what that is right now, actually. So what is vitamin K? But Hepi is a vaccine, and so that's why I said that. Anyways, so vitamin K is a fat-soluble vitamin that's needed for blood clotting. So particularly for any of you moms that are listening, if you have had a baby boy and they have been circumcised, it's likely that your provider was like, let's do this vitamin K. It's really important for them because it deals with blood clotting. And in something like a circumcision where you're going to be creating an open wound, obviously you have a greater risk for bleeding and bleeding that won't stop. Now, I'll get into it a little bit later, but yes, if you if they didn't have any vitamin K injection or oral administration, which we'll talk about today too, and they had the circumcision and they started bleeding, yes, they can administer vitamin K at that time, and it typically stops the bleeding within 20 to 30 minutes. However, obviously preventatively, they would prefer to do it preventatively. And we don't know, it can be a little scary if things do start happening that way. And anyways, so let's talk about it because there are some different options here. So it's important to note that we cannot make vitamin K within our own body. So this is something that we have to ingest and absorb in order to have. Vitamin K activates molecules known as clotting factors that help the blood to clot. And these blood clotting factors are there in normal numbers at birth, but they're not activated fully due to low levels of vitamin K. So every baby, all babies are born with these low levels of vitamin K. And it's one of those things where you're like, why? I don't have a good answer for you. We have read through the research ourselves as well, and nobody has a good answer on that, but the levels are low. It doesn't mean that all babies are at risk for having bleeding out or vitamin K deficiency, but it does mean that the levels are lower for whatever the reason. Now, babies can be at a risk, or they are at a risk for a condition called VKDB, which is that vitamin K deficiency bleeding. And that's where they start bleeding and the clotting doesn't happen, and so they bleed out. And obviously that is very scary and very serious. I also want to let you know it's very rare with or without the vitamin K injection or oral administration. However, you're going to see that those two things do lower the risk of that a bit. So there's two types of this VKDB. It's idiopathic and secondary. So idiopathic, the cause is not known. Most of the cases with idiopathic VKDB happen in babies who are exclusively breastfed. And I'm going to go into that in just a minute, so don't stress. But that secondary VKDB is when baby has an underlying disorder, such as some kind of gallbladder disease or cystic fibrosis or a medication side effect from something mom was taking. Most babies who have secondary VKDB are also exclusively breastfed. So let's dive into that just a little bit. So what is it about breastfed babies? Because we know how good breastfeeding is, and we assume that our babies are getting what they need from our breast milk. What is it that is making it so that they're not getting enough vitamin K? And so the difference is breast milk itself doesn't tend to have a lot of vitamin K at all. However, formula, because it is formulated, they can add vitamin K. And so those babies are getting a lot more vitamin K every feed. And so I guess the kind of like instant question is, well, how do I up my vitamin K in my breast milk? And this is a conversation that has been going on for some time, because I remember when I started researching things and trying to figure out for myself with my it was my second baby at the time, with my second and my third baby, this was like the question. And when I asked my pediatrician, for example, I'm like, what? Like, that doesn't sound right. Our bodies are so smart. Like, God makes us perfect. How come my breast milk does not have what my baby needs to keep him safe? I don't understand. And again, he didn't have a good answer for me. And he just said, they don't make enough. And so you got to do it. And it was what it was. And with my second, what we did, and this, again, like country to country, right? Because with my second, we were overseas in Germany. They had an oral option. And so I was like, okay, I feel better about that, because the injection has certain things in it that I didn't like, such as the preservatives or the polysorbate 80 or the propylene glycol, which we know is not good. There are different things in there that I was unsure about, or that other women I know are like, wait a second, let me hear a little bit more about this. Now, if you're listening to this, you should know that they do have a preservative-free option. It doesn't eliminate the other things that I mentioned, but it does eliminate the preservatives. And so you can request that if you decide to get the injection. request it ahead of time before you head into your birthplace. Put that on your birth plan to be able to talk to your provider about during one of your appointments, not when you are in labor and you show up at the hospital. But that is an option for you. So with my second, I was like, yes, let's do the oral one. That sounds great. Now, when you do an oral one, it's not just one dose. They want you to get in 3 doses. So there's a certain amount of vitamin K in each dose, and it happens over a period of time. Now, because our family was military and we were seen by a pediatrician on base after my encounter at the hospital, and nobody told me this. I had no idea. The hospital did not warn me. No one had told me this. They were like, we don't count that. We don't accept that as a good form of vitamin K. It's not as effective or whatever they had said. They're like, so they need to receive the injection. And so we had to have a conversation about that. Now, fast forward with my third, and I had to revisit that all over again. So back to how come my body doesn't make this and what are my options? What's interesting is if you look at the evidence or some of the research behind it, and I'm going to get into my own ideas on this because I've seen the research, I've seen people that have gone over the research, and I still have some different feelings about it, and I'll tell you why. But the idea behind their research is saying, based off of all this information, watching moms eat higher levels of food that have vitamin K in them, yes, it does raise the levels of vitamin K in the breast milk, but it's not enough to make a significant difference for the baby. And I thought that was interesting because the foods that they listed were every single one of them plant-based. And while it's true that the plants have a much higher concentration of K1, which is what you're looking to raise, not necessarily the K2. The K2 doesn't have the same effect. Stay with me here because I don't understand all of it either. I just know that there is a difference and I am explaining that to you. But those plants and whatever raise the K1, but I was looking at it, I went a little bit deeper. And this is where the more I'm learning about nutrition, the further I dive into that, the more I'm like, well, maybe these women weren't eating the things that we should be eating or that women could be eating in order to have appropriate levels of vitamin K. Maybe there's a reason that this has become more of an issue over time all over the world, but particularly in the United States. I thought that was really interesting. Or if you look at some of these other countries with what they eat as well. Because if you look at like goose liver or beef liver, I mean, you are talking goose liver was like over 300 grams or micrograms or whatever it is. Per serving or per ounce. Anyways, it was big compared to what you're going to be getting from some of these plants. And then beef liver is over 100. And so I'm like, none of them studied that. None of them studied, what specifically these women were eating. All that was done is they were testing the breast milk before they would eat and after they would eat. And so if you can't get high enough amounts in these plant forms, even though they're the highest, things that are said to have this K1, although they didn't mention the other ones that I'm mentioning, then maybe that's the issue. Maybe it's what they're putting into their body or what they could be putting into their body versus what's actually happening. So that is my own take. That is not, it's not science. It's not anything like that, but it's where my head went as I am learning more and more particularly about meat and high levels of protein and quality of food. So I thought that was pretty interesting too. I did appreciate the fact that they, we're testing breast milk before, we're testing it after, we're testing gets to the baby before, it gets to the baby after, which I think is very helpful. Now, in other countries, it is given commonly as like a 3-dose oral option. Now, the reason that moms are always questioning, which I love, I think it absolutely makes sense for every single one of us to question what is being put into our bodies and our babies' bodies, and not just question it, but like understand what's in it. Tell me more. What does it do? What are the benefits? What are the risks? What are the side effects of these things? I think that makes a lot of sense. So in these other countries where they do this 3 oral dose, one of the things that was talked about in some of the studies or cited is that here in the United States, there's a couple things. One, there's no licensed oral option of vitamin K available to us in the United States. So even if you are at a hospital or a pediatrician's office that offers that, It is not licensed within the United States. It's still your option to use it. You still need to understand what's in it, benefits and risks and all of that stuff. But you do have that option in some locations. Some locations offer it, but it's not licensed. So in these other countries, they do these 3 doses, but they also have kind of this continuity of care that happens after postpartum. So one of the things that we are always grumpy about or get frustrated with here in the United States is moms give birth and they go home and they don't see anybody until 6 weeks. Now, you go somewhere with your baby and the baby sees the pediatrician and stuff. And maybe if you have severe complication, you reach out to your provider and ask for help or to be seen sooner. But for the most part, women are not seen for 6 weeks after having their baby. And even though the baby is having some of these visits at their pediatric appointments, the 3-dose series needs to be given at very specific times and made sure that the baby doesn't spit it up. And so in some of these other countries where they have this care that follows moms home postpartum, even in Germany, when I was there, I think I've shared this with you guys before, but I gave birth, I had an OB, but I gave birth with the midwives because that's what you do there. It's like normal that like the midwives handle everything unless there's an emergency. Which doesn't that just make so much sense? Like in my head, that makes a lot of sense because OBs are surgeons and they are trained incredible surgeons for when we need extra help. And midwives are incredibly wonderful trained women for when everything is normal. Not that they can't deal with some emergent situations or anything like that, but they can't do a cesarean birth. They can't, there's some things that are limited. And so when birth is normal and natural, we have midwives who are really, really good at managing that. Not that OBs can't also do that, but it just makes sense to me to have, all of these healthy, low-risk moms treated like healthy, low-risk patients and then moved on to some extra help if needed. So when people go home in these other countries, they have midwives that care for them in the hospital and then they have home visits. Nurses come to see them in their homes, and those nurses can administer the vitamin K, the oral injections, and check on baby and make sure they didn't spit up and check on mom and all of that. So there are different reasons that it may and may not be offered in certain locations, and especially here in America, that's kind of some of the background of why that is the case. And then remember, when moms are trying to decide, do I want to do oral or do I want to do this, there are other things that they're weighing, right? So, and some of the concern even with an oral administration for moms is, well, then we're introducing something different into baby's gut. Like, are we going to mess up bacteria in the gut? Now, the studies that I went over in preparation for this, none of them covered that, which I thought was pretty interesting. Because if you're going to cover some of the side effects or things that can happen for having the injection and the ingredients that are in there, which I should say here, they have not seen recently adverse effects associated with the current vitamin K injection. However, as I'm saying recent, I was looking at studies, and some of them were early 2000s, but I think it was back in 94 or 96 that some of these things were actually studying ingredients-wise versus what was happening with babies. So I don't want to state definitively one way or the other. The other side of that is too, because of all the information that I just gave you about the amount of vitamin K that we can get into mom and baby through food or other means, even supplementation. There was some really neat information where if mom supplemented a certain amount of vitamin K, that they were getting appropriate amounts in their breast milk. And so I should pause and talk about that for a second too. So if we talked about food, I brought up specifically liver and other things other than plants that can be ways to raise that. There have been, and this was certainly a discussion, 15 years ago when I was having my babies, what if mom supplements? And at the time, there was not a lot of information on that. There's still not definitive studies about this, but they did study it a bit. And so if moms were taking supplements of vitamin K, that was transferring into adequate, at least in compared to these other options, what was happening in the breast milk and what baby was actually getting. So I think that's an option too. So you've got your food, which that can all start during pregnancy. We should be eating really healthy during pregnancy and adding in all the things that we can, but also postpartum. But since we're talking immediate postpartum, these are things that we need to do prior to, and then you just hold on to that. You keep going with your good nutrition. But the other option is to offer something to mom rather than baby and allow that to go through the breast milk. So that was an option as well. So then when we come back to the oral administration, and we're talking about adding something into baby's gut, they didn't go over all of that. And obviously it's not just clean, pure vitamin K. There's other stuff in there. And so that's where moms are like, you know what? The more we learn about the gut microbiome and how much of an effect it has on baby and years down the road, there is something to be said about that. And so I don't have super great information on that or research on that. I would love to find a little bit and dig a little bit deeper on it, but it does make sense to question it or to be thinking about, everything that we do has an effect, however small, and that is something to look into. It was interesting because, again, as I'm reading through some of this stuff, there was a study that actually associated, so I'm going to say this, but I'm like not just trying to trigger people or anything like that. So just know that. But there was a study that they were saying they had found an association between the vitamin K injection and child leukemia. And so they were kind of walking through information on that as well. Now, studies have been done since and they haven't found that. And so I'm bringing that up because I had also said, as far as we can see right now, benefits are good for what it does, or at least they're consistent. And we understand what the benefits are when we do an intramuscular injection of vitamin K versus doing nothing. And we're seeing that those benefits, obviously for the children that it saves outweighs the risks. Now, are there other things that are happening on the back end or things that maybe we haven't tracked or can't see moving forward? Yes, there could be those things. And that is why it is so fun to deep dive on these things, and also so important to trust each mother to make her own decision for her children and to respect it. But I feel like you can't make a good decision if you can't absorb all this kind of information and process it and pray about it and think about it and trust your intuition on it, because at the end of the day, we are the ones that take those babies home after any decision that we've made, and we hold the weight of the decisions that we make for that child. So, be it good or tough. And so I think it's really important to have an opportunity to have all the information. What was interesting too is as you read through studies and how these things are written, some of the people involved in the studies, and most of them are medical people, right? They, or researchers in general. And the way that they write, they're like, here's the issue, here's what we're seeing. And so the recommendation would be, or we recommend, and it's things like not offering an oral option so that we don't have parents that are refusing the vitamin K, because for them and the research that they've done, they feel that that's the safest, and that's fine. However, I don't ever believe that it is okay to force a mother or family to do something, and to not give them another option, knowing that other option might be a good one. Like for this study, the concern was if we give them the oral option, we can't guarantee that that baby's going to get all 3 doses. And so something terrible could happen. And so in the way of safety, you're like, oh, well, yeah, that makes sense. But anytime you take away a parent's right or options for things that they feel inspired, then you're leaving them in an even tougher spot. So you're like, okay, if I really don't want the injection, I would have done the oral, but you're not offering that. Okay, I'm not going to get the injection. And then what happens? What if something happens with the baby? It's like, who was wrong in that situation? And again, mom has to deal with that. So that's all of like my thought process and my personal take in that, because those are things that aren't discussed in those studies. And I do think it's interesting how they're written. So that's why I love just sitting and going over all the insight and evidence and everything. Cause it's like even evidence, even scientific quote unquote research is done by people, and people have opinions, and we all do. And so there's, like it or not, there's going to be some amount of bias to whatever is happening. And so it's interesting to read through that, and you can kind of feel one way or the other. And I think the other part of that too, even as you're listening to this, you could probably have feelings one way or the other just listening to this. And I don't mean, oh, this is what she believes or this is what she doesn't believe. I mean yourself, where you're like, I agree with this or I don't agree with this. And why is that? You're going to have your own thoughts regarding this. You're going to have your own feelings about it. And I think it's really important as a mom that because of that, like call that intuition. There's a reason that you are feeling and thinking those things, and following those is really, really important. So didn't mean to jump on that soapbox, but let's talk about just a couple of places that VKDB occurs And then I want to go over some statistics, and then we'll kind of wrap things up. But VKDB, it can also occur in 3 different patterns. So there's early, classical, and late. And we see this with other things as well, where there's like different onsets of things like jaundice, for example. But early happens in the first 24 hours of life. It's usually seen in babies that are born to moms who took medications that interfere with vitamin K. So if mom's taking something during her pregnancy, during labor, whatever the case, and it interferes with the vitamin K, then there can be some kind of like bleeding issue. So that would be the early onset. Classical onset happens 2 to 7 days of life. And this is where vitamin K levels are the lowest for all babies. So during that time. And so that's when we see the majority of any onset that we're going to see. Late happens in the first week of life, but it usually occurs during weeks 3 to 7. However, it can happen anytime in baby's life. Up to 6 months of life is what they consider late onset. Now, as I said before, treatment for any of these would be an injection of vitamin K, and that can stop the bleeding within 20 to 30 minutes. However, if bleeding is occurring on the brain, which again, this is very, very rare, but if it happens, it's very serious, then it might be too late to avoid any lifelong brain damage. And the very, very serious part of it is why when we're talking about, well, why can't we just wait and see if my baby is going to have any bleeding? That's the part that people would be very concerned about. So let's go over some statistics, and that can also help you see how you feel about these different things. When infants do not receive any vitamin K at birth, 250 to 1,500 out of 100,000 will experience classical VKDB. I also want to say that even though there is bleeding with this, whether or not moms choose to get the injection or some kind of treatment, some of this will resolve itself on its own. Not always. And so obviously the treatment is going to be a recommendation of the vitamin K injection, but just so that you're aware. And then 4.4 to 7.2 infants out of 100,000 will develop late VKDB. When infants receive the vitamin K shot at birth, 0 to 0.4 infants per 100,000 get late VKDB. So you can see the difference, 4.4 to 7.2 out of 100,000 when they do not receive the shot, and 0 to 0.4 get it when they do receive the shot. And so obviously that number drops quite a bit, and that's why it is so encouraged. Now, the shot doesn't prevent every case of late VKDB, and so even if you do all of the things, there is a very, very low risk, but it does exist that something still can happen. But most countries actually report incident rates of 0 or close to 0 when that is done, and that's why it is so highly recommended as well. So to kind of wrap things up, because I know I threw a lot at you and gave you a lot to think about, vitamin K injection comes in, vitamin K supplementation, I guess, comes in a couple of forms. It can be an injection, which you can ask for the preservative free, and it has a couple of things in it that parents may or may not like, but it's done intramuscularly, and they believe because it's done in that location that it is kind of like a slow release, and so baby receives what they need over a period of time. There is the option to try and do something with your food. It would have to be monitored. You speak with your provider. You're really clear about what you're doing. I don't know what kind of testing they would or would not be willing to do, but it'd be great if you could be like, no, test my breast milk. Let's figure this out. If you don't want to, so I don't have to do these things I don't want to do. And remember to not just include the plant foods, but also include things like animal livers. And then another option in the way of body stuff or what we're taking, supplementation, would be to take a certain amount of vitamin K as a supplement. And again, any kind of testing, breast milk and whatever. And then the last option is the oral option, which if you're here in the United States is not licensed for the United States, but some areas do provide it. And so just know that if you do the oral, that it'll have to be done at certain times after your baby is born, and you need to make sure that they don't spit it up, but they'll give you all that information should you choose to do it. The other thing to understand is that yes, this is a very rare thing for babies, but we have seen the positive effects of doing some kind of supplementation or injection or oral administration in the way of less babies having bleeding and, in rare instances, brain bleeding or something that makes it so the baby does not survive. Remember that if you're doing something like a circumcision or anything where baby's having surgery or something like that, where blood clotting, you'll be more at a risk because there is more risk of bleeding, that it's definitely going to be highly recommended at that point, which it's highly recommended now, but more so possibly even required for some of these things depending on your hospital or your state or your location. So keep that in mind as well. And then remember, just like anything in life, this is a very personal decision and you guys get to make those decisions. So I hope you enjoyed what you heard here today. I will completely admit that some of this was my personal thoughts behind what I was reading and kind of questions that came up for me. If you guys have more of that, like if you were like, yeah, it actually brought up these questions, what do you think about this, that I can deep dive further on, please feel free to reach out. You can reach me at myessentialbirth on Instagram or hello@myessentialbirth.com. And then if you guys have any other comments or questions regarding vitamin K or anything that we talk about here, go ahead and definitely take some time to reach out. But I have absolutely enjoyed. I have loved going over this with you guys today, and I look forward to seeing you next week. If you loved what you heard today, the very best way to support this podcast and help other moms to find it is to leave a quick review. I read one at the beginning of the episodes, and I would love for yours to be next. And if you're ready for even more pregnancy, birth, and postpartum goodness, come join me in the My Essential Birth course at myessentialbirth.com, where I will hold your hand and walk you through pregnancy and birth step by step so you're totally prepared for a birth you'll love. See you next week.